On one of his regular runs, Jesse was knocked from the footpath by another runner, landing awkwardly and injuring the medial aspect of his left knee. Jesse is a 21-year-old male who attends university 4 out of 7 days a week. He also works at Coles 16 to 20 hours and is on his feet for the entirety of this time. He exercises 4 out of 7 days a week at the gym and also runs. He has a suspected left medial cruciate ligament tear due to slipping off a footpath into a ditch when running. This caused pain immediately on the medial aspect of his knee, and he has been unable to fully weight bear since. He has an aortic stenosis and hemochromatosis, and previous medical history includes ligament tears of the calcaneal fibula on the left and right, and the talar fibula on the right.
Hi, how you going? I'm Courtney.
Good, Jesse.
No worries. And then throughout the day, can you just tell me a little bit about the pain and everything like that? So as the day goes on, does it get worse, or it's just constant pain all the time?
Gets worse throughout the day.
Yeah. No worries. And how's your ankle after the fall? It's fine at the moment. It's just your knee.
Yeah.
All right. No worries. So can you tell me a little about some aggravating factors? So what's making the pain worse in your knee at the moment?
Weight bearing.
Weight bearing?
Anything weight bearing. Walking.
Yeah.
So today, in a few of my tests, it's going to require me to apply some pressure and move your limbs in a few different directions and stuff like that. So is that okay with you that I go ahead with that today?
Yep.
Yeah, okay, cool, no worries. Here the orthotist is observing Jesse's balance and then continues to assess flexibility and dexterity to determine any issues with his ability to don and doff an orthotic device. This is done through a series of clearance tests. Here, the orthotist is assessing the patient's gait in both the anterior and posterior aspects of the coronal plane. This is the first of many clinical tests that will be performed. Here, the orthotist is completing further clinical testing in the form of palpation. This allows the orthotist to determine whether any pain is felt upon palpation and to feel for any heat and observe and feel for redness and swelling. Another clinical test completed by the orthotist is testing for range of motion at the knee joint. This involved using a goniometer to measure the degrees of flexion and extension both actively and passively. Once the angle of the joint is obtained, it's then to be recorded on the patient assessment form for reference in Range of movement is then tested on the affected side, and then also recorded on the patient assessment form. The orthotist also allows the patient to be aware that if there is pain or discomfort, to discontinue the movement. Now the clinician will perform passive flexion and extension of both knee joints to determine whether or not they can get further flexion or extension. This is then recorded again on the patient assessment form for future referral. Here the clinician is assessing the end feel, whether or not there is crepitus, such as grinding, or the end feel is smooth with no complications or abnormalities. Once again, the assessment is completed on the opposite side as well for comparison, and then is also recorded on the general patient assessment form for reference in future. The final test is the valgus and varus stress test. The patient is placed in a supine position with the knee flexed at 25 to 30 degrees. The clinician takes one hand on the lateral knee and grasps the medial ankle with the other. The knee is then abducted. The opposite is then done. Therefore, one hand is placed on the medial knee and grasps the lateral ankle. The knee is then adducted. Pain and excessive laxity indicate stretching or tearing of the MCL ligament.
Hi Jesse, how you going?
Good.
Okay, so from our test the other day, I've come to the conclusion that I believe you have a medial cruciate ligament tear. I'm not sure what grade that is, so what I'm going to do is I'm going to send a referral to your GP and ask him to put in a request for an MRI scan. And that'll determine the grade tear and if there's any meniscus involvement. Just from assessing you, I can see that your knee seems to be collapsing in on that side a little bit. So that'll eliminate or tell us whether or not there's an issue going on there as well. Then once we know everything definitely, we will then prescribe you an orthotic device such as a knee bracer, whichever is most suited to your tear. Okay.
Sure.
Any questions?
No.
Okay, no worries. So this referral is to you.
Cheers.
And I'll see you soon.
Thanks.
Okay, cheers.